Primary lung cancer for short, is one of the deadliest cancers in the world. On average, one person dies of lung cancer every 30 seconds. With the impact of population aging, environmental pollution, bad living habits, and increased life pressure, the number of deaths from lung cancer is gradually increasing. The high incidence and mortality rate of lung cancer worldwide has begun to attract great attention from the medical community. Due to the hidden nature of lung cancer itself, most patients are already in the advanced stage when lung cancer is discovered and have lost the best opportunity for surgical treatment. Therefore, traditional Chinese medicine treatment plays an increasingly important role in the treatment of lung cancer. The use of traditional Chinese medicine to treat lung cancer has become the first choice for lung cancer. Important treatment options. Primary bronchial lung cancer refers to a malignant tumor that originates in the bronchial mucosa and alveolar wall. Modern medicine has a low overall cure rate for this disease. Traditional Chinese medicine treatment of lung cancer is characterized by high lesion stability and long survival period, and it has potential advantages in resisting recurrence and metastasis. Improving the cellular immune function of tumor patients is one of the main mechanisms of traditional Chinese medicine therapy. Traditional Chinese medicine has a very broad prospect and development space for treating lung cancer. It is necessary to further unify and improve the syndrome types of lung cancer and explore and study the essence of each syndrome type. The reform of traditional Chinese medicine dosage forms and the development of new drugs will contribute to the development of syndrome differentiation and treatment methods, and will promote the improvement of the diagnosis and treatment of lung cancer with traditional Chinese medicine and integrated traditional Chinese and Western medicine. Primary bronchial lung cancer refers to a malignant tumor that originates in the bronchial mucosa and alveolar wall, and belongs to the categories of pulmonary tract, pulmonary rock, and pulmonary tract in traditional Chinese medicine. The overall cure rate of modern medicine is low. The median survival period is generally about 6 months, and the 5-year survival rate is only 5% to 10%. Non-small cell lung cancer, NSCLC, accounts for more than 80% of primary lung cancers, and more than half of the patients are in stages 3 and IV when first diagnosed, making treatment very difficult. Therefore, studying traditional Chinese medicine treatment for non-small cell lung cancer has important clinical significance. According to the theory of traditional Chinese medicine in my country, lung cancer is located in the lungs and is closely related to the spleen and kidneys. It is usually due to insufficient innate endowment, or due to diet, evil poisons, 6 evils, etc., which lead to lung failure, unfavorable qi movement, internal growth of phlegm, accumulation of poisons and evils, etc. The main clinical manifestations are intrapulmonary symptoms. Patients develop cough in the early stage, such as dry cough or coughing up a small amount of thick white sputum. Some patients develop severe cough. When heat poison invades the lungs, there are often symptoms such as coughing up thick phlegm. When hemoptysis and bloody sputum occur, The symptoms are intermittent and repeated bloody sputum. Patients experience chest tightness, pressure, or dull pain when they get up early in the morning, and some patients cannot describe the nature and location of the pain. There are situations where the pain has no fixed location and the chest pain is severe and unbearable. Some patients with peripheral lung cancer also experience pain in the chest, hypochondrium, shoulders, back, and upper limbs. Patients with shortness of breath experience chest tightness and worsening pain after activity. Especially in late-stage patients, lymph node metastasis will cause compression of the large bronchi, resulting in diffuse alveolar cancer, pleural or pericardial effusion, etc., and the symptoms of shortness of breath will be more significant. Since lung cancer in traditional Chinese medicine always belongs to deficiency in origin and excess in symptoms, and its main etiology and pathogenesis are pathological products such as phlegm, blood stasis, and deficiency of healthy qi, the treatment of lung cancer is always to strengthen the body, eliminate evil, and treat both the symptoms and the root cause. Due to differences in the patient and APO's own innate endowment, clinical stage, pathological type, etc., there are often obvious individual differences. Therefore, syndrome differentiation and treatment are an important treatment method for lung cancer. It can be seen that comprehensive treatment will be the future development direction of lung cancer treatment, and the status of traditional Chinese medicine treatment in lung cancer will also gradually improve, and it will no longer be limited to the reduction of toxicity and efficiency of radiotherapy. Right upper lobe cancer, left cervical lymph node metastasis, squamous cell carcinoma, chiliorone, male, 53 years old, from Shaanxi Province, China. First diagnosis came for treatment on January 9, 2013. Chief complaint: I have tightness in my left chest, difficulty breathing in my right lung, and radiating pain in my back that has worsened in recent days. History of current illness: the patient developed a cough and hoarseness in July 2012, which did not improve after treatment at the local hospital. I went to the first affiliated hospital of Shaanxi Medical University on August 7, 2012. Chest CT showed right upper lobe cancer. Bronchoscopy showed bronchial carcinoma in the posterior segment of the right upper lobe. The right upper lobe bronchi separated from the right middle bronchus and the right middle bronchus. Pathological report: TV type collagen 1, CK5, 6, plus, CK7, plus, Ki67, number of positive cells 60%. P63, 10. Pathological diagnosis: posterior segment of right upper lobe, second carina, squamous cell carcinoma, case number 12 to 12929. Ultrasound display August 31, 2012, Shaanxi Cancer Hospital. The fore area on the left side of the neck showed a solid hypoechoic mass of about 1.21 by 0.71 centimeters, oval-shaped, with blurred boundaries, uneven echo, and double the VL area of the lateral neck showed solid hypoechoicity. The size of the right neck was about 0.29 by 0.26 centimeters and 0.41 by 0.38 centimeters, and the size of the left neck was about 0.44 by 0.33 centimeters, all of which were round in shape. Color ultrasound showed one lymph node was swollen in the TV area of the left neck, excluding MT, and lymph nodes in the 6 area of the bilateral neck were swollen. No abnormalities were found in the liver, gallbladder, pancreas, spleen, and kidneys. He was admitted to Shangxiang Police General Hospital on September 19, 2012. Relevant information during hospitalization: low platelets occurred during hospitalization, and platelet-raising drugs were given until recovery. Then gamma knife treatment was performed, and traditional Chinese medicine was given at the same time. At this time, the patient and his family requested to be discharged. Discharge record: admission date, November 9, 2012, admission diagnosis, right upper lobe cancer, left cervical lymph node metastasis, squamous cell carcinoma, discharge date, November 21, 2012, discharge diagnosis, right upper lobe cancer, left cervical lymph node metastasis, squamous cell carcinoma. While Chileron was hospitalized, the attending physician suspected whether the patient had lymph node metastasis and made a color ultrasound report at the hospital on November 12, 2012. Examination sites: axilla, supraclavicular fossa, cervical lymph nodes. Ultrasound findings: lymph node-like echoes can be detected in both sides of the neck. The larger one on the left side is about 17 mm x 9 mm, and the larger one on the right side is about 21 mm x 4 mm. Renginghu, male, 64 years old, Shangguan Village, Dishan, Yaoju District, Linfen City, Shaanxi Province, came to see a doctor on March 22, 2023. Main complaint: chest tightness, shortness of breath, cough, low back pain, which has worsened in recent days. History of current illness: I developed a fever due to a cold on January 1, 2023, and the fever persisted for nearly a month. Admitted to Linfen Central Hospital on January 28, 2023, pathological examination report on February 3, 2023, pathology no K202300741, pathological diagnosis, right lung, malignant tumor, tending to small cell carcinoma of the lung, requiring immunohistochemistry further assist in diagnosis. Symptoms: weight loss, cough, blood in the sputum, chest tightness and shortness of breath, back pain, turning over at night and vomiting, nausea, fatigue, red tongue with thick sticky coating, cracks in the tongue, slow and slippery pulse. Syndrome differentiation: kidney yin deficiency, heat burning lung yin, dampness and heat trapping the spleen, and qi and blood deficiency. Treatment: clearing the lungs and resolving phlegm, drying dampness and strengthening the spleen, nourishing yin and nourishing the kidney, replenishing qi and nourishing blood. Prescriptions: astragalus, asparagus, Aphiapagan japonicus, pine and apos, S-bark, silkworm chrysalis, white silkworm, Tianzhu huan, Delone, Blatilla, Qianlong, Scutellaria barbata, Cyperus rotunda, lotus root knot, Trichosanthes, Fritillaria quinensis, coltsfoot, mangosteen, rose, Pinellia, Houtuinia cordata, agrimony. Madder, lotus root knot, narcissus, bee bamboo, dendrobium, comfrey, American ginseng, licorice. Pay once every 3 days, twice a day, take 150 to 170 milliliters. This is a critically ill patient who is hospitalized and lives in the intensive care unit, so a small amount is appropriate for home use. Peripheral lung cancer in the left lower lobe of the lung, with left hilar metastasis. Qian Yinqing, female, 73 years old, from Shaanxi Province, China. Initial diagnosis: the patient came to see a doctor on June 10, 1998. Main complaint: the patient and APO's condition has worsened recently due to long-term cough, chest tightness, shortness of breath, and blood in the sputum. History of current illness: the patient went to Heping Hospital affiliated to Changji Medical College for a CT examination on June 2, 1998. CT number 2891, plain CT chest scan, lobulated masses in the lower lobe of the left lung were uniformly protuberant, surrounded by pressure changes on the left main bronchus. Preliminary diagnosis: 1. Peripheral lung cancer in the lower lobe of the left lung. 2. Left hilar metastasis. On June 4, 1998, the patient, accompanied by her children, went to Shaanxi Cancer Hospital for another examination. Experts from the hospital checked and the results were the same as before. The children requested that the elderly be hospitalized for surgical treatment. The experts from the hospital suggested: 1. The elderly is old and his condition has metastasized, so surgery is not suitable. 2. Conservative treatment is very suitable for the elderly. He went to Professor Chen Hailin for treatment on June 10, 1998. After taking more than 20 Chinese medicines and nearly 3 months of clinical treatment, the lesions have disappeared. In mid-April 2003, the old man weighed 105 pounds and still helped his family with some housework. Note: the patient is old and frail, weighs 73 pounds, has long-term chest tightness, asthma, and cough, and suffers from lung yin deficiency, spleen failure, phlegm coagulation, qi stagnation, and blood stasis. The prescription includes Fritillaria quinensis, Trichosanthes, winter flower, Platycodon grandiflorum, and Z1, which have the effect of clearing away heat and moisturizing the lungs, relieving cough and reducing phlegm. Because of dryness, heat and burning of the body, American ginseng, lotus root joints, Blatilla striata, Shishang cypress, and aphrodisiac are mainly used. For strengthening the spleen and removing dampness, orange peel is mainly used. Citrus aurantium has the effect of regulating qi and removing blood stases. Atractylodes and Radix pseudostellari can strengthen the spleen and stomach. Gecko, cordyceps, silkworm chrysalis, and astragalus have the effect of nourishing the lungs and qi, helping to strengthen yang and nourishing the kidneys. Millet's batholobus has the function of dredging meridians, reducing swelling and dissipating knots. Ziziphus jujube kernel, cypress seed kernel, poria Chen, antler cream, Eucommia ulmoids and donkey hide gelatin are good for nourishing qi, blood and promoting body fluids. The diagnostic and imaging data of traditional Chinese medicine and modern medicine are organically combined to formulate symptomatic medicines to carry out gasification and intervene in the gasification center, spleen and stomach, of the human body, carry out the up and down of the gas exchange mechanism, enter the focus, and quickly curb the spread of cancer cells. Metastasis directly destroys mutated cancer cells to repair missing and mutated cells and cytoplasm. Through multifaceted gasification and evolution, cancer cells are rapidly and orderly reversed into normal physiological cells. The so-called quification means that various life phenomena in nature are produced on the basis of normal climate changes in nature. If there is qi, there will be transformation. If there is no qi, there will be no transformation. It is stated in the great treatise on the Yuan dynasty of Qian, and it is qi in the sky and form on the earth. The form and qi are influenced by each other and transform into all things. Therefore, the understanding of human physiology and pathophysiology in the Hui Nei Jing is completely understood from the perspective of qi transformation and the physiological phenomena, pathological phenomena, and diagnosis. Treatment and prevention of diseases of the human body are studied from the perspective of qi transformation and principle, thereby quickly achieving the goal of curing tumors through the evolution of pneumatization. From the tangible to the intangible and the gas to the popular, it can be endlessly prosperous. Central lung cancer in the right lung with mediastinal lymph node metastasis, advanced non-small cell lung cancer, Wang Qirshan, male, 48 years old, from Shaanxi Province, China. Initial diagnosis: the patient came to see a doctor on December 7, 2005. Chief complaint: the patient suffered from sternum tingling, chest tightness and shortness of breath, and back pain that had worsened recently. History of current illness: the patient was admitted to the Beijing Cancer Hospital in 2002 due to the early stage of lung cancer. His condition had been stable during his hospitalization. Suddenly, on November 2, 2004, he underwent a re-examination after radiochemotherapy for lung cancer. The condition worsened. The hospital adjusted the treatment plan according to the condition and increased the risk. Great drug effect: in addition to conventional treatment, add 1 pill of Iressa imported drug every day, and after 5 months of continuous use and adjustment of treatment, I was admitted to the hospital with hospitalization number 11473 on March 8, 2005. Clinical information: review after chemotherapy, CT chest enhancement at the examination site. Imaging opinion: the right lung cancer is larger than before, the lymph node metastasis is roughly the same as before, and the upper lobe of the right lung is atelectasis. Was busy and had to interrupt treatment. According to family members, they often didn't and even have time to eat, and sometimes they worked underground with the workers all night long to mine coal. The doctor felt deeply sorry for his discontinuation of treatment. May he take good care of himself in the days to come. Note: the patient took pure Chinese medicine for 4 months. Comparison between the 2 examinations and the chest CT on November 9, 2005, 1. The right hilar mass has shrunk compared to before, now about 39 by 30 mm, originally 52 by 41 mm, 2. The range of distal lung atelectasis has shrunk compared to before, with scattered areas in the right lower lung. The flocculent lesions are absorbed compared to before, 3. The multiple nodules in the left lung are reduced and shrunk compared to before, 4. The original largest lesion is now a patchy shadow on the edge, 5. The solid part in the center is about 11 by 9 mm, which was originally 45 by 36 mm. Ma16, now the maximum is about 13 by 10 mm, originally 24 by 17 mm, 6. The paratracheal and left hilar lymph nodes in the mediastinum are smaller than before, and now the maximum is about 15 by 14 mm, originally 25 by 17 mm, 7. The right pleural effusion is smaller than before. Imaging opinion: the right upper lung cancer with multiple metastases in both lungs has improved compared to before. The mediastinal and left portal lymph node metastases have improved compared to before. Lung cancer in the upper lobe of the left lung, with mediastinal lymph node metastasis. Yang Shanhu, male, 38 years old, from Lujiazhuan village, Makhang town, Changji city, Shaanxi province. First visit: came for treatment on May 1, 1998. Chief complaint: the patient had cough, low fever, fatigue due to a cold, and his dyspnea has worsened in the past week. History of current illness: the patient underwent CT examination at Changji Traditional Chinese Medicine Hospital on April 29, 1998. CT number 0851. CT chest scan: the localization film showed a round mass in the upper lobe of the left lung, the left main bronchus, and the trachea is compressed, and the main trachea is displaced to the right. A round, irregular lobulated soft tissue mass can be seen in the anterior segment of the upper lobe of the left lung. The size is about 72 mm x 69 mm x 70 mm. The density within it is uneven. The CT value is 35 Hu, 68 Hu. The mass as it is in contact with the aorta and is greater than 180 degrees. There is a mass-like soft tissue density around the aorta. Several swollen lymph nodes can be seen in the prevascular space. The bronchi are compressed and narrowed, and the bronchi are shifted to the right. The crescent-shaped watery density of the left posterior chest wall. CT value 15 Hu. Preliminary diagnosis: left upper lobe lung cancer with mediastinal lymph node metastasis, invasion of the descending aorta and pulmonary artery. Lung cancer, multiple nodules in the upper lobes of both lungs and the lower lobe of the right lung, metastasis is not excluded. Liu Haishou, male, 57 years old, from Shilia Village, Luqing District, Changji City, Shaanxi Province, came for treatment on September 20, 2009. Main complaint: chest tightness, shortness of breath, difficulty breathing, cough, blood in sputum, which has worsened recently. History of current illness: the patient had a spiral CT examination report at Changji People's Hospital on August 14, 2009, disc number 17062. Chest examination findings: plain scan showed that the shape of the bilateral thorax was acceptable, the lung markings were clear and normal, and multiple occult nodules were scattered in the outdoor areas of the bilateral lungs with rough edges. The largest one was about 15 mm, and no other abnormal densities were found. Film. The trachea and bronchi in the mediastinum are unobstructed, the shape of the heart and great blood vessels are normal, the hilus on both sides is not large, there are no enlarged lymph nodes or other